Life expectancy estimates that describe the population as a whole also suffer from a lack of reliable evidence gathered from these periods. In a 2010 article published in the Proceedings of the National Academy of Sciences, gerontologist and evolutionary biologist Caleb Finch describes the average lifespans in ancient Greek and Roman times as short at approximately of 20 to 35 years, though he laments these numbers are based on notoriously unrepresentative graveyard epitaphs and samples. Moving forward along the historic timeline, Finch lists the challenges of deducing historic lifespans and causes of death in this information vacuum. As a kind of research compromise, he and other evolution experts suggest a reasonable comparison can be made with demographic data from pre-industrial Sweden, mid-18th century, and certain contemporary, small, hunter-gatherer societies in countries like Venezuela and Brazil. Finch writes that judging by this data, the main causes of death during these early centuries would most certainly have been infections, whether from infectious diseases or infected wounds resulting from accidents or fighting. Unhygienic living conditions and little access to effective medical care meant life expectancy was likely limited to about 35 years of age. That's life expectancy at birth, a figure dramatically influenced by infant mortality, pegged at the time as high as 30%. It does not mean that the average person living in 1200 AD died at the age of 35. Rather, for every child that died in infancy, another person might have lived to see their 70th birthday. Early years up to the age of about 15 continued to be perilous, thanks to risks posed by disease, injuries, and accidents. People who survived this hazardous period of life could well make it into old age. Other infectious diseases like cholera, tuberculosis, and smallpox would go on to limit longevity, but none on a scale quite as damaging as the bubonic plague in the 14th century. The Black Plague moved through Asia and Europe, and wiped out as much as a third of Europe's population, temporarily shifting life expectancy downward.